So I've had a lot of questions from a lot of people about, CEREC in general, and how do we work with a team efficiently to make sure that our CEREC is utilized and that we're offering that to our patients. A couple of things for you to consider as you either start using CEREC or recommit to using CEREC, or as you're trying to up your game. Number one, we want to make sure we're offering the best treatment that our patients can possibly receive. We want to always make sure that for their needs, we're offering them the best possible treatment. Now, I acknowledge that in some situations, and based on your training and clinical experience, CEREC may not necessarily be the best treatment for every situation. If you look at dental implants, I oftentimes have this conversation with my patients. A dental implant for almost everybody in almost every situation is the best choice for treatment. But for some people, it's not. And a lot of it has to do with their individual, situation, whether it's periodontal disease or smoking or bone levels, etc., etc. Sometimes what's the best treatment for someone is not the best treatment for others. So we have to bear that in mind as we're preparing and presenting treatment to our patients. So with regard to CEREC, what's the best treatment for this patient in this situation? So the question is, number one, is a CEREC inlay or onlay better than a filling? A composite filling or an amalgam filling? In my opinion, yes, it is in almost every situation a better solution. It's a stronger material generally, much stronger, has a lower failure rate, provides us with a better opportunity to control all of the factors involved with bonding, and interproximal contacts tend to be much, much better. So generally an inlay is going to be a much better solution long term than any type of a restoration. I've read studies that show that inlays have less than half the failure rate and better than twice the lifespan of a composite filling when placed correctly. Now, inlays are a little more challenging to execute than fillings for a lot of us. And a lot of that primarily is due to the fact that some of us don't have a lot of experience doing the prep, which is different from a filling, and also the design work. Let alone the fact that holding on to those itty-bitty little things can be quite challenging. So as I'm presenting, and I know I've mentioned this in other videos, as I'm presenting treatment to my patients, I'm always recommending a composite filling as an alternative to an inlay. But the inlay is the primary choice. And I'll always tell the patient this is the best choice, the best solution for you long term, because I can control all the factors, less than half the failure rate, better than twice the lifespan across the board. So yes, it's a little more expensive in the long run, in the short run rather, but in the long run it's a lot less expensive because you have to replace them less frequently. I had a viewer ask me a question about how many inlays and onlays I've had to replace over the years. Of my own inlays and onlays I've had to replace with crowns over the years. And I had to think about that. I honestly don't think I've had to replace very many that have failed. I can think of a handful, and when I say handful, maybe 5, maybe 6, no more than that certainly, as I've been using CEREC for 12 years, 2006. Generally if you pick your battles well, if I'm picking, making sure that I'm recommending an inlay or an onlay where it's appropriate versus a crown, then we should have a very low failure rate. So that being said, pick your battles well, make sure that you choose appropriately what restoration you're going to recommend. So of those failures I've had, I think most of them are, based on some sort of a chip. And they usually happen at those line angles. There'll be a chip of one of the mesial buccal line angle or the distal buccal line angle. I haven't had any straight up failures of these restorations, just because we've been able to manage them so well and, burnish the edges, polish those down like you would for gold. So as we're recommending this treatment to our patients, always remember, number one, to have their best interest at heart, not your best interest. We want to make sure we're focused on their welfare, not their wallet, and then making sure that we believe in what we're recommending. Some of us, whether we're inexperienced with CEREC or whether we're inexperienced in dentistry generally, may not have a lot of confidence as we're presenting those treatments to the patient. And I've found that the more confidence you have, the more the patient believes in you, the more likely they are to accept treatment. And that kind of goes without saying. As you're confident, the patient can feel that. So, one thing for you to consider is as we are discussing treatment, recommending treatment, talking about options with the patient, is make sure you believe in what you're recommending. I had a conversation with another dentist yesterday who's a little less experienced than I am, only a few months. Very capable, very well trained, very well spoken, but not a lot of experience yet with CEREC. And so the question revolved around, well, how do we get you, the new dentist, to feel comfortable with recommending CEREC because you believe in it and you understand it? Well, I'd suggest first, make sure that you agree with the science. Look at all the studies that are out there. Discuss and make sure that you are comfortable with the long-term outcomes, the strength of the materials, the process that's used to make them. And that's number one. So understand the science, make sure you're comfortable with that. Number two, get comfortable with the process. How many of us go ahead and do something that we don't really know how to do yet and assume that we can figure it out as we go? So yes, a lot of times if you have a safety net, if you've got a more experienced doc, someone who's done CEREC a lot more in the office, if you get hung up, yeah, you can get some help. But I would suggest that you consider making sure that you've done your homework. You got to put in the hours at home or away from patient time to make sure that you can do what you need to do. That being said, what does that look like? So I would suggest typodont time. Get yourself a typodont, prep some teeth. Actually do the prepping, especially for the inlays, because they're a little unique. It takes me a lot longer to prep an inlay than it does to prep a composite filling, for instance. And make sure that you're comfortable with prepping them with the draw path, the insertion, making sure you have no undercuts, and then coming up in your mind where you would convert from an inlay to an onlay and then to a crown. Oftentimes we don't know exactly what we're going to get into when we start a procedure, and so we're not sure exactly what it's going to look like inside. So we're guessing it's going to be an inlay, but sometimes we underguess, if you will, and it ends up needing more than an inlay. So where do you draw that line? Where's that line in the sand when you go from, well, you needed an inlay and now we're going to talk about needing a crown or an onlay, or I guess we could possibly do a composite. Again, where would you draw that line? So getting comfortable with the execution is critical, and that really speaks volumes once you're comfortable with the execution and the design process in particular with recommending it to our patients. And again, they can feel that confidence. They can absorb it, feel it, and then it's much easier for them to accept your treatment recommendation because they feel that you're confident in your treatment. So as far as the design process with an inlay or an onlay in particular, I would suggest that if it's taking more than 5 minutes to design any single restoration, any one restoration, you probably ought to work on your design skills. Now, that's not to say that you immediately need to be designing in less than 5 minutes. That's not what I'm saying. What I'm saying is that should be your target. 5 minutes is a good goal for a design time for a single restoration. Now, when we're talking about anterior teeth and matching some unique anatomy, that may be a different story. But I'd say 5 minutes is a good target. A molar sometimes we can have done in 1 minute or even 2 minutes if you get a good proposal and there's very little editing. But those anterior teeth can be a challenge. Inlays and onlays generally can be very, very quick because they're all molars or premolars, so not a whole lot of unique anatomy that goes there. So making sure you're comfortable with the execution, the design phase, and then the delivery. Now when we're talking about delivery, delivery can be a challenge with inlays and onlays. And I've found the most common challenge is that there are sharp edges internally. So your prepared tooth is sharp internally, which prevents the inlay from seating all the way without engaging somewhere. So as you're prepping those inlays, it's vital, it's absolutely critical, just like it is with crowns. The inlays and onlays must be smooth and rounded. The machine, for some reason, and it's probably the camera and the design, the way they set it up, when you get an area that's narrow and pointy, the machine doesn't image that well, and sometimes you'll get an undermill, which means your restoration will not seat all the way. So having very clear, well-defined smooth margins and no sharp or rough areas internally will make that delivery process so much easier. So to go back to what we very first started talking about, as we're re-engaging in CEREC, or as we're doing our daily work, our bread and butter dentistry of fillings and crowns and bridges and dentures and stuff, we want to make sure that we have confidence in what we're recommending, in our execution, and our delivery. Otherwise, it's very difficult to get patients to accept treatment. I would not suggest faking it till you make it. We don't want to be deceptive in any way, but make sure that as you're designing, as you're going through the process, you have confidence because you've actually done it many times. So that requires practice, like I said before. So practicing on the typodont and making sure that you are comfortable with your design process will solve all those problems. And again, focus on the patient's welfare, not their wallet. We're here for them. It's not the other way around. They're not here for us. We're here for them. And I think in the end, you'll end up upping your game if you can really focus on the patient, get the practice that you need, making sure that your execution and delivery is high quality. Thanks for watching.